In South Africa, the vaccine train brings jabs to remote communities. The country is now administering 1 million doses every 4 days. The government says it has secured sufficient vaccines to vaccinate the entire adult population. Supply is no longer a constraint. Yet vaccine hesitancy is hindering inoculation in the country worst hit by the pandemic in Africa.
They are afraid. Others mostly is about side effect, whether they will fall sick after getting the jab. Others pay, but mostly they are afraid of the size of the needle. Because apparently, when you guys show it on TV, it seems huge.
Another recurring concern is whether the jab could impact anti-retroviral drugs used to treat HIV, of which South Africa has the world's highest prevalence. Others are afraid it could affect the fertility of men and women. Doctors say vaccine hesitancy in South Africa is threatening the entire vaccination drive. This is your COVID-19 special on DW. I'm Janelle Dumalaon. At this stage, less than 15% of the South African population is vaccinated, even as supplies are widely available. Our correspondent Adrian Krish has this report.
It's payday for social grants in the town of Thulamahashe. Hundreds of people have traveled in from surrounding villages. The province of Mpumalanga is one of the poorest in South Africa and also has one of the country's lowest vaccination rates. That's why health workers have set up a mobile vaccination site right next to the queue. It is easier for me when I can get vaccinated at the same place where I pick up my social grant. They only came once to my village to vaccinate, and I only learned about it when it was too late. That's why I'm happy I can get it here today. Mobile vaccination sites are being set up next to welfare offices and supermarkets where grants are paid out all over the country. The idea: take the vaccine to the people.
So in the course of today, about 700 people over 60 will collect their grants. We know that people over 60 are far more vulnerable and far more exposed to COVID and severe consequences from COVID. So it was an obvious thing to come to the queue where older people are collecting their grants to offer vaccines, because they are already in town at a place where they are easy to find and approach and offer the vaccine.
Less than 1 in 5 people in Mpumalanga have been vaccinated so far.
Many people here haven't been vaccinated because they live in rural areas. It is expensive and difficult for them to reach vaccination centers.
It's not just access to vaccination that's stopping people getting the jab. There are other worrying reasons, says Elizabeth Oduwole. She's been researching why people in Cape Town are reluctant to get vaccinated. People's religious beliefs are one issue. She has ideas on how to combat this.
If religion has been pointed out in a particular population, then what will be recommended is what I'll call, or what is generally called, the stakeholders engagement. Engage religious leaders, opinion leaders, community leaders, and for social media, that's a tough nut to crack.
Those waiting for their social grants in Mpumalanga have also heard many rumors about vaccination side effects. But Carlos Mavanga isn't worried. He says all his friends who got it are doing fine.
Charles Usonga is the director of the South African Cochrane Center at the South African Medical Research Council. Welcome back to the program, sir. We've seen in the report there that vaccine hesitancy is still an issue. How much has willingness to get the vaccine changed over the course of the pandemic in South Africa?
So thank you for inviting me to have this conversation with you. And just to situate this in context, we have a long and proud history of childhood vaccination in South Africa dating back to the 1970s. And it is estimated that childhood vaccination saves 4 million lives every year around the world, and of course also in South Africa. And with COVID-19 vaccines being very new, there have been some concerns, and from the surveys that have been done in South Africa, it shows that about between 60% and 70% of South Africans are willing to take the vaccines, and about a third do not want to take the vaccines. And this varies from time to time.
Right. Now, how is this vaccine hesitancy being dealt with?
You know, a lot of people, they have genuine concerns about safety and effectiveness of the vaccines. So they need information, and they need accurate information. So in South Africa, we have various communication strategies that have been used to provide the right information to people. And also at the individual level, also encourage that family members who have taken the vaccines to talk to their friends, talk to their family members in an empathic way. They should show compassion, try to understand why people have concerns about vaccination, what the concerns are, and then providing the right information to them.
Now, one interesting I found was that vaccination approval in people 18 to 34 years old seems to be especially low, something I read earlier today. What's the reason for especially young people's hesitancy towards the vaccine?
You know, young people, like also the adults, they might also have some concerns based on rumors around the safety and effectiveness of COVID-19 vaccines. But beyond that, the young people often think that they are not much at risk, so they are complacent. So they think that the disease is a disease of the old and not a disease for them. But there is also something, there have been a lot of rumors circulating in social media, and the young people tend to have more access to social media. And as you know, social media allows for easy mass communication, making it easy for people to share fringe opinion and disinformation. And often it is difficult to find out what is true from what is not true. And so this misinforms the young people, and we need to provide them with the right information.
Now, next to misinformation, of course, and the spread of fake news, as you mentioned, accessibility seems to be a problem as well. What is being done to help people in rural areas to get the jab?
Yeah, like you rightly said, access to COVID-19 vaccines in rural areas is a challenge. Often people have to travel for very long distances, spending money on transport to come to vaccination sites. So what is being done is that more vaccination sites are being opened in rural, remote areas. Mobile vaccination sites are also available. And also, there are vaccination sites along the social grant queues. So when elderly people and vulnerable people are waiting to take their monthly stipends in some form of social grants, vaccination is being offered to them. So having those mobile vaccination sites next to grant queues and next to shopping malls enables rural people who come there to get the vaccines.
Now, briefly, if you can, how confident are you that with all these measures, the vaccination rate will pick up in South Africa?
I am very confident that with all these efforts, using all these various multi-pronged strategies, that a lot of South Africans will come up for vaccination when it is their turn. And I am confident that by the end of the year, we'll have very high vaccination rates in South Africa. But we have a lot to do. We shouldn't be complacent. We need to continuously give information to people, encourage them to come, share positive stories about other people who have been vaccinated, and a lot of people will come for vaccination.
Charles Wisonga is the director of the South African Cochrane Center at the South African Medical Research Council. Thank you very much.
Thank you.
And now we come to that part of the show dedicated to your questions. Here's our correspondent, Derek Williams.
Israel was testing for COVID at McDonald's drive-thrus. What are some other innovative ideas for tackling the pandemic?
Crises force us to find solutions, and the pandemic has driven innovation in a huge number of ways in a really vast range of fields. Off the top of my head, your comment about fast food restaurants in Israel also serving up vaccines reminded me of a recent event that took place here in Berlin when public transport authorities turned a train into a mobile vaccination center. So many showed up to get shots that a lot of people had to be left behind on the platform. Robots and drones are also being used a lot in innovative ways to fight the pandemic. For example, like these in Indonesia that have been used to deliver food and medicines to homes and to ships where COVID-19 patients are in isolation. But for me, by far the greatest innovation during the pandemic has been the rapid development and approval and deployment of messenger RNA vaccines. The incredibly promising technology isn't new. We've been working on it for decades, but until now, it had remained tantalizingly out of reach. And then the pandemic caused us to really hit the gas on them, and mRNA platforms have finally arrived. In the future, they'll allow us to react to changes in mutating pathogens with tweaks to vaccines a lot more cheaply and a lot more rapidly. And they can even be designed to attack non-infectious diseases like cancer. So if there's a silver lining to COVID-19, it's that in the future, the mRNA vaccines developed to fight it and what they teach us will save many, many more lives far beyond the pandemic.